Hi everyone, I'm Nushrat Khan. I'm a research fellow at Imperial College London, and I'm supporting the NIHR Global Health Research Center partners with co-design of multi-sectoral interventions. I believe that many of you have covered the fundamentals of participatory approaches and the NIHR course on community engagement already. So today I'll introduce you to different frameworks and methodologies for complex intervention development, focusing more on design thinking and planetary health approach. There is no one-size-fits-all approach, so my goal is to provide you with many tools that you could incorporate into your co-design or co-production journey. So here is an overview of the content. We'll cover the key concepts and definitions at first, followed by a range of theories, models, and frameworks. Then we'll talk about different participatory approaches. I'll introduce you to some examples and the design thinking approach. Then we'll talk about how to incorporate theory of change and a range of methods such as gap analysis and prioritization techniques when trying to adapt or select from a range of interventions. Then finally, when we have a set of intervention components that we would like to implement, how do we assess the suitability and feasibility of those intervention components prior to implementing? And finally, we'll talk about what are the next steps in implementation process. So first of all, let's start with some key definitions, as you'll be using these terms throughout your implementation process over and over again. Context. A context is a set of characteristics and circumstances that consist of active and unique factors within which the implementation is embedded. So it's an aggregation of multiple different factors that we will look into more in more details. Then setting is specific to a physical location in which an intervention is to be implemented. When speaking of intervention, it could be any program, service, policy, or product that is intended to ultimately influence or change people's social, environmental, and organizational conditions, as well as their choices, attitudes, beliefs, and behaviors. In terms of implementation strategy, this is outlining how an intervention will be delivered. And implementation agents refer to different stakeholders involved in the implementation process. This could be individuals or organizations targeted or affected by the implementation of an intervention. Those who are implementing the intervention itself, and also those who decide on the implementation of an intervention. This could be decision makers, such as policymakers and funders. Now, so we talked about what an intervention is. So interventions can often have a single focus, for example, a specific surgical tool designed for operative purposes. A multi-sectoral intervention brings in multiple sectors, as the name refers to. For example, this could be government bodies, academic institutions, citizens, and beneficiaries, such as and health systems. And this is often the case of complex interventions. Development of an intervention is usually followed by feasibility testing, pilot implementation, and evaluation, where the process is often iterative and you will be refining the intervention further based on evaluation and follows the process of improvement. Understanding the context in which an intervention will be implemented is core to developing a solution targeted for a specific community and location, keeping in mind cultural practices and values. And this is why engaging with the community is very important, to understand their perceptions and involving them in developing solutions that matter to them. And co-creating interventions is part of the process where inputs of all relevant stakeholders and beneficiaries are embedded to develop a meaningful intervention. The complex intervention development framework summarizes what we have just discussed. At the center of the core phases, which are developing or identifying an intervention, assessing feasibility of the intervention, pilot implementation and evaluation, there are 6 elements that are integral. So we have already talked about context. Considering context is very important, as this is where the intervention will be embedded. You need to develop, refine, and test your program theory throughout the process, which is why the intended program or intervention will achieve change, that the change it's trying to make. Engaging relevant stakeholders throughout the process, identifying key uncertainties, which could be determined by the different components in the context, refining the intervention throughout the process based on these outputs, and also taking economic considerations into account, as this will ensure whether an intervention will sustain in that specific context. In recent times, it has been increasingly encouraged to take a planetary health approach when developing and evaluating interventions. Planetary health is the health of human civilization and the state of the natural systems on which it depends. And this is particularly important for our center's work as we explore the intersection of health and environment. So the planetary health framework in this slide has been done by a recent study where the authors have put together all different criteria that needs to be taken into account, which includes the intervention in the center, and surrounding this is our power relations, governance, prosperity, equity, impact on health, and then the outermost layer incorporates different environmental factors such as pollutants, minimizing pollutants in air, soil, and water, protecting biodiversity, animals and plants, protecting and managing waters and lands. Now, not all interventions may incorporate all of these factors, but this provides a thorough guideline and a set of questions that you can consult when developing and evaluating interventions. Now let's talk about participatory approaches we can take to develop or adapt a new intervention. You will come across a range of terminologies such as co-creation, co-design, and co-production. While all of these terms have slightly different meanings, the key or common element is active participation of and input by citizens in shaping services. Co-creation is an overarching term which refers to creative problem solving between diverse stakeholders at all stages of an initiative. Co-design refers to active collaboration in the design of solution to a pre-specified problem. Co-production often comes towards the end, when implementing previously determined solutions to a previously agreed problem, with emphasis on the most efficient use of existing resources and assets. So the participants may not be involved in actively designing a solution in this case. Let's look at some examples in the following slide. So let's look at some examples of co-design in practice. Co-design is often used for collaborative design of a new product with user feedback and testing. For example, it's been used for designing a new mobile or web application. Participatory urban planning involving local communities is also an example. Then it's often used for health services design with patients, healthcare providers, and administrators. And this can also be used for collaborative creation of public policy with citizens and stakeholders. Now, when co-designing an intervention, there are various approaches that you can take, but a common approach is the double diamond design framework, which has 4 different phases: discover, define, develop, and deliver. So the discover phase is the divergent phase where you're considering many different ideas, and following this is the convergent phase, define, when you are using some different approaches to select some core ideas. And then you go on to developing all these different intervention components. So again, diverging to include all different ideas. And finally, you are delivering that specific intervention to the specific user group or community. So in the following slide, we will talk about another framework that incorporates these ideas into research. So Bart and colleagues put the concept of co-design in a research context and produced this generative co-design framework. So the first phase of pre-design includes contextual inquiry, which we have already touched base on in the beginning. Then step 2 involves any preparation and training for co-design activities. In the co-design phase, we want to inform the stakeholders about the findings from our contextual inquiry by framing the issue. Then the design part in step 4 can include specific methods that are suited to the intervention that we're trying to develop or the issue at hand. And then once the co-design activities are done, participants share their ideas to collate the findings. And once everyone is in agreement with the findings, the team moves on to the post-design phase to analyze the data for reporting, and then translation, requirements translation, which involves understanding how the intervention will be implemented in practice. There are a range of activities that you can incorporate in your co-design process. Here are some examples, and there are many literature on arts-based methods. Group sketching or prototyping are often used. If you're developing videos, then storyboarding could be a good option. Storytelling can be used for content to generate awareness. And your choice of methods may also depend on your user groups. For example, if you're working with young people, you may want to choose tools such as Lego or other game-based methods. So here is an example of co-designing a web-based intervention for people in the retirement transition. Remember the framework we discussed earlier. So in phase 1, they conducted contextual inquiry, including systematic reviews, qualitative research, and consulted with other resources. And taking this forward in the co-design workshop, they brainstormed a range of new intervention ideas. So think about the discover phase in the double diamond design framework. And then taking the outputs forward to the second phase, they validated the intervention principles and core concepts. And then these outputs have been translated by the team. And then the final co-design workshop conducted de-risking the prototype, testing functionality, etc. So this is just an example. There are lots of literature are out there about co-designing different types of intervention that you can explore for your own work. Moving on to co-production framework. This is based on an existing study called Assist and Frank that aimed to adopt an existing effective peer-led smoking prevention intervention called Assist by integrating new content from the UK drug education resource Talk to Frank to co-produce 2 new school-based peer-led drug prevention interventions. If we look at the left-hand side of the framework, this is very similar to contextual inquiry of the co-design framework. The key difference here is the adaptation of existing content by taking user feedback through an iterative process in the middle. Different tools can be used in this step, which we'll explore further in the second part of the lecture. So the draft intervention is then reviewed by the experts and tested with young people at the right-hand side, and essential training is also provided for intervention delivery. This is just one example, but this process can be adapted to different co-production scenarios. This diagram is from a recent systematic review that explored the trends and patterns in the application of co-production, co-design, and co-creation methods in studies of green spaces. It shows you the diversity of activities, which are grouped under art space in blue, digital in yellow, physical activities in gray, and communication activities in orange, where you can see communication activities are widely used in this area. While some of these techniques may apply in your work, there may be more techniques that would be relevant to your area of focus, but this is a good overview and a good place to get ideas for your work. Here is a co-creation framework I've adapted from the co-design framework by Bird and colleagues that I shared earlier. Using this as a guide, we will discuss different frameworks and tools that we can use for formative-based research synthesis under planning stage, and different activities in co-design and co-production in the second lecture. Here is an example of a co-creation workflow put together. We will discuss different frameworks and tools we can use for formative phase research synthesis and co-design and co-production activities in the second part. So see you there.